Welcome to Paramedic Zach. If you didn't know, each episode consists of 10 randomly selected questions from a deck of 500. These 500 flashcards are what I studied exclusively in preparation for my National Registry Paramedic exam. In this episode, you'll have 5 seconds to answer each question, and in part 2, we'll review each question in greater detail. So stay tuned for flashcards 51 through 60. My name is Zach, and this is Paramedic Zach, and those are sirens. Again, welcome and thank you guys for joining. So let's move right into question 51. Name the breathing pattern. So this is a bit of a trick question because there really isn't much of a pattern to go on, and that's kind of the point. An irregular respiratory pattern with variable tidal volumes is going to be known as biats or ataxic breathing, and this is generally going to be found when there is pressure on the patient's medulla oblongata in the brain. Moving on to question 52. What is a normal end-tidal CO2 for an adult and pediatric patient? So for both the adult and pediatric patient, a normal end-tidal CO2 is going to be in the range of 35 to 45 millimeters of mercury. Question 53. This kind of cranial hematoma can be asymptomatic for days to weeks after injury. So a cranial hematoma that can be asymptomatic for days to weeks after an injury is known as a subdural hematoma. Alright, question 54. To maintain brain, kidney, and coronary artery perfusion, a MAP greater than blank must be maintained. Also, what is the MAP formula? So MAP stands for mean arterial pressure, and the reason why it's important is because in order to perfuse the body's organs and tissues, a certain pressure must be maintained within the arteries. This pressure needs to be greater than 60 millimeters of mercury in order to properly perfuse the brain, the kidneys, and other vital organs. Now, most modern monitors will calculate the mean arterial pressure for you, but if you do ever need to calculate it yourself, here's the formula. The mean arterial pressure is going to be equal to the systolic blood pressure plus 2 times the diastolic blood pressure, all divided by 3. This is going to give you your mean arterial pressure in units of millimeters of mercury. Question 55. What are the 5 T's in reversible causes of cardiac arrest? Alright guys, so your first T is going to be a tension pneumothorax. Your second T is going to be tamponade, i.e. cardiac tamponade. Your third T is going to be toxins. Your fourth T is going to be thrombosis of the lungs, i.e. a pulmonary thrombosis. And your fifth T is going to be a thrombosis of the heart, i.e. a coronary thrombosis. These 5 T's in conjunction with the 5 H's are going to be used to determine a possible cause of cardiac arrest. Question 56. Decreased blood pressure stimulates the release of renin, which cleaves angiotensinogen to form angiotensin I. Angiotensin I is then converted to angiotensin II with the blank, which promotes the release of blank from the adrenal cortex. Alright guys, I know that one was a mouthful, but the answers here are going to be ACE, which is the angiotensin converting enzyme, and aldosterone. So decreased blood pressure stimulates the release of renin, which cleaves angiotensinogen from angiotensin I. Angiotensin I is then converted to angiotensin II with the ACE enzyme, which promotes the release of aldosterone from the adrenal cortex. Moving on to question 57. DCAP-BTLS stands for... So DCAP-BTLS is going to guide your trauma assessment and is going to represent looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. Question 58. What are the normal hemoglobin and hematocrit levels for women and men? So occasionally you find yourself responding to a medical facility for a patient with critical labs. This can be any number of things, but one of the things it can be is an abnormal hemoglobin and hematocrit level. As you probably know by now, your hemoglobin carries oxygen on your red blood cells. Your hematocrit levels are your percentage of red blood cells compared to the rest of your blood. So an abnormal one would be anywhere outside these ranges. For women, it's going to be a hemoglobin of 12 to 16. For men, it's going to be a hemoglobin of 14 to 18. For women, it's going to be a hematocrit of 35 to 45. And for men, it's going to be a hematocrit of 40 to 50. I know these are a lot of numbers to remember, so what I did is kind of simplified it. It's not exactly right, but it does work. So what I try to remember all the time is 15 and 40. Both of those numbers fall within the normal ranges for hematocrit and hemoglobin levels for both women and men. Question 59. In pericarditis, ST elevation is seen in which leads? Again, this is kind of a trick question, but not as much as the last one. That is, you're going to see ST elevation in all or nearly all of your leads when your patient is positive for pericarditis. The only exception is that you may not see any elevation in lead V1. And last up, we have question 60. What are the 7 rights of medication administration? So the 7 rights of medication administration are used to make sure that you're delivering your medication properly. The first right is going to be the patient, so making sure that you have the right patient for the right medication. Secondly, you want to make sure that you're given the proper medication to the proper patient. Thirdly, you're going to make sure that you're giving the medication over the proper amount of time. Some medications require a 10-minute infusion, while others need to be pushed rapidly. Fourth is the proper route. That is, you're giving your medication through the proper route. For example, you're not giving your asthmatic patient 2 grams of magnesium sulfate intranasally. Number 5 is the right dose. So make sure you're not underdosing or overdosing your patient, and make sure you're using the proper dose when the medication is weight-based. Number 6 on the list is making sure that your medication is not expired. And number 7 is proper documentation. That is, making sure that you've written down when the medication was given, how much of the medication was given, and how it was given. Alright guys, and that is going to do it for this episode. I wanted to take a minute and remind everybody that there are timestamps in the description with each individual question written out. So if you don't have time for the full episode, or you're just interested in a particular area, make sure you check those out. They can be super useful. And again, there are going to be part 2s to these episodes. They're just going to be a little off in the future. So I'll see you again next week for another rapid fire review, and until then, take care.